So you're welcome to today's webinar. We're going to be talking about the causes, the treatment, and the causes and the treatment. Hello, good afternoon. Am I in?
Yes, we can hear you.
Okay, so sorry. Okay, good afternoon, everyone. My name is Umi Alaka. You're welcome to today's webinar. The webinar is about kidney disease, common causes, early symptoms, and treatment. We have two panelists on board today. We have two doctors. We have Dr. Ebun Bamboye, and we have Professor Toyin Aymara. Let's welcome Dr. Niyi for the opening remarks. Dr. Niyi is the medical group head of LCCI, Lagos Chambers, Thomas Medical Division and Pharmaceutical. So let's welcome Dr. Niyi for the opening remarks.
I think Dr. Nee might have been disconnected, so someone might need to take charge.
Okay. Can we have Funke to please take the opening remarks?
Dr. Nee is back. Is back in. Dr. Nee, your opening remark.
Yes.
Dr. Nee, you have the floor for your opening remarks, sir.
Thank you. Okay, all right, thank you. All right, the president of the Mrs. Toki Mabugunje, ably represented today on this call by Mr. Idaosa, who is the vice president of Lagos Chamber of Commerce and Industry. He's also the chairman of the Trade Promotion Board of on this call. The Director General of Lagos Chamber of Commerce and Industry, Mr. Muda Yusuf, our speakers, Professor Oluwatoyin Amira, and also every that was able to. Thank you so much for your time. So World Kidney Day is celebrated the second Thursday of every of March. There are two main around kidney, the importance of kidney health. And the second thing is to try to reduce the frequency of kidney diseases. Apart from reducing the kidney and the frequency of kidney diseases, is also to awareness around the kidney. So this year, the team is living with kidney diseases. The team for the World Kidney Day for 2021 is living. Looking at Nigeria, it's believed that about 8% of medical admissions is due to kidney disease. So was being it's probably a major reason why whether it's why people travel. Diseases is important to talk about. Yes, about if we try to prevent kidney diseases, is important. One, to talk about the early, the common causes. If we are, it's also important to talk about the early symptoms. And again, for whoever has the disease, it's important to be able to talk about what are the treatment options available. So we have our everyday distinguished will help the common causes and the early symptoms, why Dr. Ebubangboye will to the treatment. I'm very optimistic that we're going to have very fruitful and very great discussions this morning. Thank you all. Have a great discussion. Thank you. Bye.
Thank you, Dr. Nii. Thank you, Dr. Nii. So the next on the agenda, like I've not mentioned, the ground protocol is that if you have a question, please drop it in the quick Q&A section so that we'll get all the questions on time to prepare it down for the doctors. So the next in line right now is the opening remarks by the president of the LCCI in the present of Mrs. Toki Mabonje. Let's welcome Mrs. Toki Mabonje online. Hello, Ma, you have the floor. Hello.
Good morning, ladies and gentlemen. Can you hear me?
Yes, we can, Ma.
I bring you greetings from the President of the Lagos Chamber of Commerce and Industry, Mrs. Toki Mabonje, who is at this time in another event. I am Gabriel Damosa, Vice President of the Lagos Chamber of Commerce. So on our behalf, I want to welcome you and present our opening remarks. Distinguished speakers, Dr. Ebubangboye, consultant physician and nephrologist, head of the dialysis and transplant units, and clinical director of St. Nicholas Hospital, Lagos. Professor Oluwatoyin Amira, consultant physician and nephrologist, Lagos University Teaching Hospital, and Professor of Medicine, College of Medicine, University of Lagos. Our chairman of our medical group, Dr. Nii Oshomole, distinguished ladies and gentlemen, I'm delighted to be here this afternoon as chief host at this webinar organized by our medical pharmaceutical and allied services group. I join the chairman and the entire members of the group to welcome our guest speakers, dignitaries, guests, and our friends from the media. The focus of this web conference has encapsulated in the theme, kidney diseases, common causes, early symptoms, and treatment, is to bring into focus the very important issues of kidney diseases in Nigeria in commemoration of the World Kidney Day 2021. Issues of kidney diseases and its management are critical components of our health sector development, given the high number of people living with kidney diseases in Nigeria and the kind of healthcare and medical procedures required for the management of the disease. The increasing number of Nigerians with kidney diseases and the fact that a large proportion are unaware at the early stage of the disease makes its management difficult. This underscores the need for increased sensitization of the public in order to reduce the incidence of severe kidney failures. Accordingly, it is imperative to pay attention to the following: the awareness and orientation on different stages of kidney disease to manage the conditions of progression into advanced stage. Integrated and holistic symptom management for all patients with kidney disease, strengthening of the country's health delivery system to ensure effective management of the disease and improve access to health care by those living with this condition. Improving the national health care insurance coverage to include cost of treatment of patients of kidney disease to lessen the burden of care of individuals. Distinguished ladies and gentlemen, once again, I welcome you to this very important health care webinar. I look forward to an exciting moment of deliberations and interactions. I thank you all.
Thank you so much. That's the speech from the president. Thank you so much. The next in line right now, we're going to start the webinar in full gear right now. So we're going to invite Professor Oluwatoyin Amara. Professor Oluwatoyin Amara is a consultant physician and nephrologist in LUTH, Lagos Teaching Hospital, University Hospital, Professor of Medicine in LUTH. Professor Toyin, you have 15 minutes, and Professor Toyin is going to discuss on the kidney diseases, common causes, and early symptoms. I repeat again, the topic is kidney disease, common causes, and early symptoms. Good morning, Ma. You're welcome online. You're welcome on board. You have 15 minutes, Ma. So,
thank you very much.
I have a question. Just 1 minute, Ma. Please. Same ground rule again. If you have any question, please post it on the Q&A. We will pick it up from there. Thank you so much. Ma, you have the ground. You have 15 minutes, Ma. Thank you so much, Ma, for coming.
Thank you very much, the medical group of LCCI, for inviting me to be part of the World Kidney Day webinar. The theme, as we know, for this year is living well with kidney disease. And my task this morning is to talk about the common causes and symptoms. But before I go on to that, I would like to talk a little bit about the kidneys and what they do. The kidneys are vital organs about the size of your fist. They're bean shaped. There are 2 of them located at the back on either side of the spine. They keep the inside of the body. They keep the blood clean and chemically balanced. And this is necessary for the proper functioning of all the other organs of the body. Therefore, when the kidneys fail, all other organs stop to function well. So this underscores the importance of the kidneys to the body. Now, the basic functions, most times we know they excrete waste products that are generated from the breakdown of normal tissue and metabolism of the food we eat. They remove drugs and toxins from the body. They help to maintain fluid and acid-base balance. And that is why when you take water in excess, you excrete the excess in the urine. And when you're not taking enough water, your urine is concentrated. That's one of the functions of the kidneys, to regulate the fluid content of the body. They also, the kidneys also produce what we call hormones. They are special chemicals. You have erythropoietin that helps the bone marrow to produce enough red cells. And red cells carry oxygen around the body. The heart and the blood vessels generate blood pressure, but the kidneys help to regulate blood pressure. And that is why when there is kidney failure, the blood pressure becomes difficult to control. The kidneys also help with maintenance of bone integrity by making active vitamin D, which we know is important for bone integrity. So what are we talking about today? Kidney failure. There are 2 types of kidney failure: the acute kidney injury or kidney failure. That is not the thrust of my talk today, but we are talking about end-stage kidney failure which results from prolonged kidney disease. Kidney failure is a condition that occurs when the kidneys aren't removing the waste, they're not maintaining fluid and chemical balance. And these waste products accumulate in the body and becomes toxic to the body. You can see healthy kidneys here and diseased kidneys over there. What is chronic kidney disease? It is a progressive, irreversible loss of kidney function which develops over months or years and is on the rise. About 850 million people worldwide have kidney disease. And in Africa, 1 million patients with end-stage kidney disease die every year from complications related to kidney disease. A look at the burden in Nigeria. We don't have a national data or national survey, but we just have small community-based studies, and the prevalence is put at between 11 to 20%, which means that between 26 and 36 million Nigerians are suffering from various degrees of kidney disease. In Lut, where I practice, on the average, receive between 40 to 50 new cases per month. And the problem with kidney disease in Nigeria is that it affects people in the 3rd and 5th decades of life. The mortality, that is death from kidney disease, is very high due to high cost of treatment and late presentation by the patients. And only approximately 10% of our patients on dialysis are alive by 1 year. Who are those at risk for kidney disease? Those who have high blood pressure, diabetes, a family history, Black people who don't know for some reasons, older people, age greater than 60 years, those who are morbidly obese, or babies that are born small for gestational age. And if you have had a previous history of an acute kidney injury, you are at risk for developing chronic kidney disease. So what are the causes of chronic kidney disease in Nigeria? Chronic kidney disease is usually caused by another condition, and we'll look at them in a moment. High blood pressure or hypertension. Hypertension is very common in Nigeria with a prevalence of around 30%. That is 3 out of 10 adults above the age of 18 have high blood pressure. Next is diabetes. Diabetes is on the increase. The patients are living longer and developing chronic complications like kidney disease. The prevalence of diabetes too is on the rise. It's about 5.8% in the community. The problem is that hypertension and diabetes account for nearly 70% of all cases worldwide. Both conditions, like I said, are on the increase. They are not properly detected, and if detected, they are not properly treated. And in patients or individuals who have these conditions, it kind of accelerates progression of chronic kidney disease. Next is glomerulonephritis, which just means this is another common cause, especially among young adults in Nigeria. It's an inflammation of the glomeruli and small vessels within the kidneys. You can see this place is reddish and is inflamed compared to the normal. And it is an immunological reaction. The immune system of the individual is attacking body tissue. The causes are some bacteria, can follow some bacterial infection, and HIV. HIV is a common and important cause of chronic kidney disease in Nigeria. Hepatitis B or hepatitis C and lupus nephritis. Obstruction is another common cause, but sadly, obstruction is a preventable cause of kidney disease. Obstruction, especially in men due to enlarged prostate gland, it obstructs the outflow of urine. The obstruction has to be in both kidneys to cause kidney failure. And in women with advanced cancer of the cervix, we see quite a number of them coming down with obstruction to the urinary tract. There are less other common causes which I will just gloss over. Reflux nephropathy. As reflux just means that instead of urine going out through the urethra, some of it goes back to the kidney. And repeated reflux can predispose to infections, and the repeated infections in the kidneys can cause ultimate damage to the kidneys. Hereditary diseases like polycystic kidney disease, people are born with cysts in the kidneys, and the cysts get bigger and bigger as the individual is getting older and causes damage. It compresses the normal kidney tissue. Sickle cell disease is common in our environment and is another cause of chronic kidney disease. Obesity, the world is getting very obese. Currently, there are about 1.6 billion obese people worldwide. And obesity, either alone or through diabetes and hypertension, can cause kidney disease. In this environment, we take a lot of herbal concoctions. We don't know the constituents. And some of them contain toxins that are injurious to the kidneys. Analgesic abuse, especially analgesic concoctions, when taken on a long-term basis, can damage the kidneys. Use of bleaching creams containing heavy metals like mercury, which can be absorbed and damage the kidney. You can see the warning sign on this skin lightening cream that it can damage the skin and cause kidney and brain conditions. So what are the symptoms of kidney disease? Early stage, unfortunately, does not have symptoms. You only pick it when you do laboratory tests. So when the symptoms appear, the disease is already advanced. And so, but what are some of the telltale symptoms? Swollen feet and ankles, having swelling around the face, especially in the morning when one wakes up, frothiness of urine, need to wake up at night several times to pass urine, and in the later stages, reduction in urine output, weakness, just feeling unwell and fatigue. For those who have high blood pressure, they realize the blood pressure becomes difficult to control. What I tell people and what I tell my colleagues is, once you see crazy blood pressures, 200, 130, 180, 120, please screen for kidney disease. There's also loss of appetite, nausea, and vomiting. So leg swelling, commonly seen, and it has to be on both legs. Here is frothiness of urine. This is not beer, but frothy urine. Early morning facial swelling or generalized body swelling, as seen in these pictures. This is just a summary of some of the symptoms: tiredness, nausea, vomiting, bubbly urine, persistent itch, shortness of breath, difficulties with sleep. They sleep more during the day and are awake at night, and swelling around the ankles. What are the consequences of kidney disease? Like I said in my opening remark, when the kidneys fail, the internal milieu is disorganized, so all the organs of the body don't function well. Kidney disease predisposes to heart disease, so heart failure, heart attack. Brain, they tend to have strokes. They can have seizures from the buildup of the waste products. Severe anemia, making the individual very weak. The lungs are flooded, and so there's shortness of breath. The bones are soft and friable and fracture easily. In the stomach, you can have stress ulcers and bleeding. And this is the organ that controls bone function. It becomes hypertrophied. So in summary, I want to say that kidney disease is a disease of public health importance. Prevalence is rising, outcomes are poor, and cost of treatment is high. Diabetes and hypertension account for 70% of cases worldwide, and they are on the increase because we are adopting Western lifestyle. Initial stage is asymptomatic and can only be detected through laboratory tests. Some symptoms include leg swelling, facial swelling, frothiness of urine, tiredness, feeling unwell, and difficult to control BP. Therefore, it is cheaper to prevent than to treat chronic kidney disease. I want to end by just mentioning a few kidney-friendly practices. Adopting healthy lifestyles will help us not develop diseases that will predispose to kidney disease, like not smoking, eating right, eating healthy, reducing salt intake, drinking enough water. Water is the best beverage created by God. Moderation in alcohol intake, exercising regularly so that we keep our weight down and keep fit. We are expected to exercise 3 to 5 times a week. Aerobic exercises are recommended, like jogging, bicycling, brisk walking, swimming, and dancing. We should cultivate the habit of regular medical checkup. For those who are hypertensive and diabetic, they must have their blood sugar and blood pressure controlled by taking medications regularly as prescribed by the physician, and treatment is for life. Don't stop. check for those who are hypertensive and diabetic or have relatives who have suffered from kidney disease or are obese. They must check their kidney function 1 to 2 times a year. Avoid indiscriminate use of medications. They could be toxic to the kidneys, especially NSAIDs. There is a special type of analgesics used for arthritis. Avoid prolonged use. Avoid herbal concoctions. Don't use mercury-containing cosmetics. And most importantly, I want to wish everybody a happy World Kidney Day, and from henceforth, begin to love your kidneys. Thank you so very much for your attention.
Thank you so much, Ma. We really enjoyed the section. There's quite a lot to learn. Thank you so much for the wonderful section. Thank you, Prof. So the next in line right now, we have Dr. Ebumbangoye. Dr. Ebumbangoye is coming online. She's a consultant physician nephrologist, head of dialysis transplant unit, clinical director, St. Nicholas Hospital, Lagos. Let's welcome Dr. Bangoye online. Dr. Bangoye, you have 15 minutes. Thank you so much for coming, Ma. Please, you can keep putting your questions on the Q&A sections. Thank you so much for coming. Hello, Dr. Bangoye, you can have the floor, Ma.
Good afternoon, everybody. I hope you all can hear me.
Yes, we can.
I thank Professor Amira for that excellent presentation, which generally makes my job a lot easier. She has focused on the common causes and presentations, and my focus will be mainly on the ways by which we can manage kidney diseases. She's already helped by actually indicating the fact that the best thing is to prevent it, because once you do get it, it's one of the more difficult things we have to treat. As we all know, it's World Kidney Day, and the theme this year focuses on ensuring that we involve our patients in the way we manage them. The World Kidney Day has been in existence since 2006, and each year a different theme is taken. But as we said, this year, we're looking at living well with kidney disease and ensuring that our patients are taken into consideration. We take their views into consideration when we decide the different modalities for managing them. As she said, it's a very common condition, and we estimate that over 850 million persons around the world have one stage or the other of kidney disease. And the burden is believed to have become even more significant in the developing world where we exist. But like I said, this year, the focus is on living well with kidney disease, and that's why this theme has been chosen. And it's for us to, as both patients and those that manage them, to ensure that we empower our patients in the course of our management. We look at their symptoms and not just look at the aspects of their care that are convenient for us. We should involve them in all that we do. We know that it's very common around the world, as you said, but unfortunately, in our own part of the world, it has become a major problem in the sense that it's such an expensive disease to manage that even though 16% of the population lives in our own part of the world, we're only able to manage about 1% of those people. And just as a reflection of that, this is a study that was done at the Obafemi Awolowo University, where over a period of several years, they looked at 1,208 patients that they had seen during that period. As she said, they represented almost 10% of all the admissions that they had. And when they analyzed them, they found that the majority of them did not survive beyond 3 months. As you might have heard during Dr. Amira's presentation, only 10% of their patients survive beyond 1 year. But the focus of my presentation is to show us that even within Nigeria, it is possible, if we do the right things, for us to identify our patients early. That is aside from ensuring that we carry out measures to prevent progression to kidney disease from the conditions that she has mentioned that commonly lead on to kidney failure. But even when it has happened, detect it early and carry out measures that ultimately would retard the rate of progression. Because we know that once it starts in our own part of the world, it's such an expensive disease to manage. It's almost impossible for us to deal with it. And that is why, as she said, over 1 million patients are believed to die of kidney diseases in Africa every single year. What are the situations that exist in our own community? We find that we have a tendency to visit our herbalists, like Dr. Juma, who can treat and solve many problems, from bewitched people to swollen body, which I believe is kidney failure, to court cases. Even our herbalists now believe they can treat and manage all conditions, including kidney failure. And they've actually gone digital, as you can see, with his computer and his various ways of divination to treat your condition. We have a tendency to visit various churches and prophets, all of whom have special healing prayers that they can give. Even the evangelical churches have healing and praying days. And the poor state of some of our hospitals. This is Makina Royal Hospital, with the small doctor right there in front of us. And then even the regular hospitals, you find that they go beyond what are their limits. You have this Ebenezer Dental Clinic that not only treats the dental conditions it's set up to, but also looks at menstrual pain, fibroids, stomachache, stomach trouble, chest pain, and other conditions outside its limits. And then we've been flooded by various individuals who leave their country to come and set up hospitals here. And in a lot of instances, as I tell my patients, they cannot have the interests of us as Nigerians better than those of us that are here in Nigeria. And as you can see, this big man with that big injection for this small child. And then this penchant for us to pray about everything. And when a study was done about the rates of daily prayer worldwide, you found that Nigeria has the highest number of people who say that they pray every day. Rather than focus on things that we know would definitely help to reduce the incidence of the conditions that we treat and to manage them properly, as said, we tend to want to just go and pray about it. And that's why the health-seeking behavior and access to healthcare facilities at the primary level is what is reflected here. Very few people, less than 50%, would visit the hospitals. Most will go to patent medicine stores, traditional healers, all of which would just go about and compound the problems. Despite the fact that we know that kidney diseases are a major problem in our community, we know that roughly there are about 100 new cases every single year per million population. So with our population of about 200 million, we expect that there will be over 20,000 individuals requiring care, requiring either dialysis or transplantation every single year. And if you add to that the pre-existing patients, we should have close to 100,000 people on dialysis. But what do we find in our community? We have less than 2,000 people that are on regular treatment for this condition. And that is a major problem for us. Major in the sense that we don't even have the numbers, even though when we compare ourselves with other countries in Africa, we probably are doing better off than several of the other countries, but we still do not have enough to cope with the numbers. There are various ways that kidney failure, once it has become established, can be managed. And it consists of, in the early stages of kidney failure, what we call conservative management, where the individual is instructed on his diet, control of his blood pressure, control of blood sugar if the diabetes was what led on to the kidneys failing. But ultimately, once the kidney fails to an extent that it is insufficient to be able to maintain the individual's internal milieu, it becomes necessary for that individual to have either dialysis or a transplant. Now, what is the availability of this in Nigeria? We find that there's peritoneal dialysis, which has been in existence since 1966. But you find that because it is not routinely and widely available, it is more or less restricted to just the pediatric patients who, and only because those do not have access to hemodialysis. Hemodialysis has been in existence at Louth, where Professor Amira worked since 1981. And currently there are over about 180 dialysis units spread across the different parts of the country. And currently close to 200 trained specialists to be able to manage these patients. And then the ultimate, which is kidney transplant, is also available in about 15 units around about the country. This is the distribution of the dialysis capacity within the country. And what you find is that most of them are distributed within the southern part of the country, restricted numbers in the northern part of the country. In terms of that distribution, you find that the major distribution is between Lagos and Abuja, which together are responsible for up to 30–40% of the total number of centers that occur within the country. In terms of the burden of these therapies, you find that dialysis costs on average about 75,000 naira every week. Each session costs about 25,000, and you generally would need about 3 sessions to be able to sustain yourself weekly. So in essence, you're spending close to 4 to 5 million every year just on hemodialysis. Transplant, which is also available, costs between 7 and 10 million. And that doesn't end it all, because after transplant, you still would need to sustain the graft by regular use of medications. When we compare the two modalities for managing end-stage renal disease, that is whether an individual continues on dialysis or continues and goes on to have a transplant, we find that a transplant is the better of the two options. It is cheaper. Worldwide, if you compare the cost of transplant in the chart that you see, it's less expensive than peritoneal dialysis, which is also less expensive than regular hemodialysis. Also important is the quality of life and extension of that life. You find that when you do have kidney failure, what happens is that it reduces your expected remaining lifetime. If you remain on dialysis, that's the lower red line in the chart. That is what happens depending on the different age ranges that you have. When you do a transplant, it improves you, but never really takes you back up to normal. And in terms of looking at the risk of mortality, comparing patients on dialysis and those who've had a kidney transplant, and you follow them up over 1,800 days, which is about 5 years, you find that individuals who have a transplant do much better and are less likely to die at the end of 5 years than those who remain on dialysis. The other point to briefly make reference to is that the living donor, the patient who has a transplant, the shorter the time that the individual spends on dialysis before he does the transplant, the better. The shorter the time, the better the long-term survival of that graft. And the individual who donates is also, according to this chart, lives longer. I mean, some individuals might be worried about going ahead to donate a kidney to a relative who ends up with end-stage renal disease. And this is just to reassure you that current research actually confirms that the long-term outcomes for individuals who donate a kidney to a relative is quite good. And in countries where they followed them up over 25 years, where they compare them with age and sex matched controls in the community, they found that those who actually go ahead and donate kidneys actually live longer than those who don't. Some people might wonder why that is. The main reason is that before we accept you as a donor, we would have screened you. You wouldn't have hypertension, you wouldn't have had diabetes, you wouldn't have chronic infections. And generally, you will do better than the average person in the community. And by going ahead to donate a kidney, your lifespan is not in any way shortened. But like I said initially, cost is a major issue, particularly in our environment. Transplant is available in all parts of our continent, but mainly in the southern part and in the Maghreb. But the few places in the east and central parts of the country where it's available are indicated in that chart. In Nigeria, there are over 15 transplant units that are consistently carrying out transplants. Those 15 are not as evenly distributed as you would expect. Out of the 15, 6 of them are actually located in the southwest part of the country. There are 3 in Lagos and 3 in Abuja. And the other regions of the country just have 1 unit that is functional for now. And this is the distribution around the different parts of our country. The 2 most active units are, of course, Zenith, which is a unit based in Abuja, and St. Nicholas Hospital. And these are the numbers of transplants that each of these units have done in the last 3 years. That is excluding the last year, 2020. So the total number of transplants that have been done in Nigeria, approaching 800. All of them have been live donors. We don't have the capacity to do cadaver-related transplants yet. Our experience at St. Nicholas, just as a reflection of what we've been discussing, we see an average of about 150 patients every single year, which is roughly about between 10 and 15 patients per month. The number of dialysis sessions that have been carried out over the years since the onset of the unit, over 5,000 sessions every year. And the number of sessions that were done per month in this particular year. This is a reflection of the patients, and as Professor Amira said, we generally tend to have a very young, much younger population of patients requiring kidney care in our own environment than occurs in the Western and developed world. And it's mainly because of the causes that we find are responsible for kidney failure in our own environment. Whereas abroad, diabetes is the major cause, in our own environment, it's generally glomerulonephritis. And as she did mention, most of these are from chronic infections that are common in our environment. Generally, it tends to affect males more than females. And generally, our patients tend not to survive long. But I think in quite a number of the private hospitals who tend to have patients that are supported, we have outcomes that are just as good as they might be with patients abroad. And that is a reflection. The poor outcomes that we see has nothing to do with the competence of the individuals that are involved, but more to do with the capacity to be able to cope with the costs that are entailed in the management of these patients. We've done transplants at St. Nicholas for over 21 years now, and the numbers
you need to start rounding up, sir.
Yes. So I'll just talk about a few things. Us as a nation accept that the provision of universal healthcare is a fundamental human right, and provision of care for patients that require dialysis is a requirement. We must ensure we develop the capacity to be able to provide whatever is required. And these services should be available for everyone at costs that are affordable and at locations that are within the reach of all, be you in the urban or the rural area. And we should start looking at alternatives, technologies, or adjusting the technologies to be able to suit our environment. But most importantly, we must screen, we must detect early, and we must realize that no government on its own can provide for all. And we have the NHIS. We must advocate and get government to ensure that within the National Health Insurance Scheme, there's provision for patients that might require dialysis and transplant. Thank you very much for your attention.
Thank you so much, Doc. Thank you so much, Dr. Edmond. That was very insightful. Thank you so much for the time. Now we'll move on to the question and answer section. Okay, I'm going to start from Prof. I have like 2 questions for you, Professor. I have 2 questions for you, Ma. Someone asked a question here. He said that can a chronic kidney disease patient have the coronavirus vaccine? Hello, Prof. Are you online?
Yes, I'm online.
Okay. Someone asked a question, and he said that can a chronic disease patient have the coronavirus vaccine? He wants to know, and he wants to know why. Okay, if known, he said if known, there are some vaccines that are safe, such category of persons. So why no? So he's asking that even if you say no, that's why no, that since some of the vaccines are safe for such people, so why no? So Professor Amira, please, you have the floor, ma, to answer the question.
Yes, thank you. Yes, kidney patients can have the vaccine so long as they can have the vaccine. They can have the vaccine because they're actually highly predisposed to COVID-19. We had quite a number of our patients during this COVID-19 pandemic coming down with the virus. A few survived, some died, some survived. So they are free, they can have the vaccine. But with regards to post-transplant patients having the vaccine, I will refer that to Dr. Bamboy. But if it's chronic kidney disease, they can. But the issue is whether they will be able to mount enough response to the vaccine is another issue, because chronic kidney disease is a state of suppressed immunity. So they can, but whether they will be able to mount adequate response, because even the routine vaccines we give to them, we have to give several, like hepatitis B vaccine. Most of them don't mount enough antibody response to the vaccine. Thank you.
Well, a quick word as to post-transplant patients and the COVID vaccination. There are currently 3 recognized vaccinations that have been produced for against the coronavirus. So there's the Moderna, there's the Pfizer, and there's the AstraZeneca. And more recently, there's the Johnson & Johnson. For the 3 that have been recognized, studies have been done in the UK and in the US amongst post-transplant patients specifically. And all 3 versions have been found to be effective. As Professor Amira did say, our patients, either pre or post-transplant that have chronic kidney disease, are particularly vulnerable. And it is recommended that they should actually be high up on the list of prioritization when it comes to decisions as to who should get the vaccines, because they're more prone, and when they do get the infections, they generally tend to be a lot more sick than the average other person. And what is certain is that the vaccine is actually safe for them to use. The vaccines that post-transplant patients should avoid are the live vaccines. And none of the vaccines currently in existence are live vaccines, so they're safe to use.
Thank you, Dr. Bamboy. I have another question for you, sir. Someone raised a question here. He said, what's the treatment for kidney stone?
There are various therapies for kidney stones. And as Professor Amira did mention, there's a potential that if the stones cause obstruction, that they can damage the kidneys irreparably. So it is something that we should not avoid, or we should try to avoid. like she said, the best is prevention. And we sometimes believe that one of the significant predisposing conditions to your developing kidney stones is that we don't take enough water. So we recommend that everyone should ensure that they take not less than about 1.5 to 2 liters of water throughout the course of the day. But if you then develop kidney stones, there are various therapies that are available. Some of them are medical. If the stone is at a location and at a size that makes it amenable to such treatment, there are drugs that you can give that can facilitate your expulsion of the stone. But once the stone becomes bigger than a certain size, then there's the need for you to either shatter the stone into smaller sizes, and there is a therapy known as lithotripsy, which you can have extracorporeal or intracorporeal versions of, or you can actually then go in endoscopically to shatter the stone and extract the stone. And the last of the option, if you don't have those minimally invasive methods, is to actually go in physically to remove the stones. But recognize that kidney stones can cause a lot of pain and discomfort. And if it causes an obstruction, can lead on to kidney failure. So should not in any way be ignored.
Thank you so much, Doc. At this time, I would like to recognize the presence of Dr. Muda Yusuf. Dr. Muda Yusuf is the Director General for LCCI, Lagos Chamber Commerce. Thank you so much for coming, Dr. Muda Yusuf.
Thank you very much. It's my pleasure. Thank you.
Okay. Sorry, Dr. Embu, there are so many questions for you here, sir. Someone just asked here, he said that, how long will a living donor be on medication after donating? Hello, Dr. Bangoy, are you online?
If by donating, the individual becomes a patient that requires to be visiting the hospital and using medications, then ideally we should not go ahead ethically with taking a kidney from a live donor. So the only reason why we accept to take kidneys legally and ethically from a live donor is that we believe that at the end of it, he lives just as long and as well as he otherwise would have lived if he hadn't given the kidney. And if you remember the chart that I showed, it actually reflects that their lifespan is not in any way shortened. So other than the initial pain from the surgery post-transplant, which you expect should resolve within about 4 to 6 weeks after the individual has donated, the person goes back to a completely normal lifestyle without the need to use any other medications going forward.
Thank you so much, Dr. Bangoy. Prof, I have 2 questions for you here. Hello, Prof.
Yes, I'm with you.
He said, please, is there any relationship between kidney failure and liver disease?
Yes, there's a relationship. People who have advanced liver disease can develop kidney failure. It's the other way around. That is, liver disease can lead to kidney disease, especially the acute kidney injury. So that is what we call a peritoneal syndrome. So individuals with advanced liver disease can develop kidney disease, yes.
Okay.
And then some causes of advanced liver disease like hepatitis B, hepatitis C are also causes of kidney disease.
Okay, thank you so much, Ma. Another question for you, Prof. He said, can someone drink too much water? If yes, what damage can it cause? But I doubt that.
That's a funny question. Thank you. If you take a lot of water, if you drink a lot of water, if your kidneys are functioning well, the excess water will be excreted. But in the setting of kidney disease or kidney impairment in kidney function, it is not advisable to take excess water. you have to take the recommended daily allowance given to you by your doctor, because if you take excess water, the kidneys will not be able to excrete the excess water. It will be retained in the body and it will cause body swelling, and it could be the lungs could get flooded and cause shortness of breath. So in the setting of normal kidney function, it shouldn't be a problem because the kidneys will excrete the excess. But when there is kidney disease, it calls for caution.
Thank you so much, Ma.
And we are advised to take about 2 liters of water per day. Except for those who have kidney stones, in which we advise them to drink more.
Yes. Okay, Dr. Bangoye, thank you so much for your time, Ma. Dr. Bangoye, I have a question for you. Someone said that, someone asked a question. He said, would like to know what available treatment for sorry. Okay, he said, would like to know the available treatment for kidney stone here in Nigeria and if they are effective and non-advancing treatments.
Okay, I had made some reference to it. Yes, you have invasive and non-invasive methods of dealing with kidney stones. So you have the extracorporeal lithotripta or lithotripsy, where you use shock waves to shatter the stone into smaller bits, which can then be passed down through the tube which takes urine from the kidney, which you call the ureter, into the bladder and out. So that exists in Nigeria, and there are quite a few centers available in the country that have such. You also can do it by the intracorporeal lithotripsy, where you non-invasively endoscopically pass a catheter into the ureter. And that tube you can then use to harness the stone and then pull it down through the opening, the vesicoureteric opening into the bladder and outside. So these methods all exist in terms of the non-invasive methods. But then ultimately, and in some instances, you find that not all stones, particularly the larger sized ones and the ones that have been there for a long time, are amenable to such non-invasive methods of managing them. So invariably, you find that those ones you might end up having to go through surgery. And there are quite a number of surgeons skilled in that. You call them urologists all around the country who have the capacity to be able to deal with that. But certainly the smaller stones, which if you detect early, there are in existence the non-invasive methods of dealing with them as well.
Thank you so much, Dr. Bangoye. Sorry, please, in 2 minutes, you can just please round up any advice, any further notes to us. Hello, Dr. Bangoye.
Okay, well.
Do you have anything to say just to round up?
Well, just to say thank you for inviting us and recognize that today, World Kidney Day, is an opportunity for us to enlighten the public. And as we had said during the course of the webinar itself, these things are better prevented than managed. So control your blood pressure if it's high, control your blood sugar if you're diabetic, eat the right things, avoid things that are toxic to the kidney, but more importantly, ensure that you check on yourself on a regular basis. Regardless of whether you have any of these conditions, ensure that you do a general medical check at least once or twice in a year. And if abnormalities are detected, please see the appropriate person to manage them. Thank you.
Thank you so much, Doctor, for your time. Thank you. We really had a wonderful section. Prof. Hello,
yes, Prof. Yes, I'm with you.
In a few minutes, Ma, do you have anything to say to round up?
Yes, Dr. Bangoye has said most of it, but to re-echo the fact that today is World Kidney Day, so go get tested, go check the status of your kidney. Thank you.
Thank you so much. We've had a wonderful time. Thank you, Prof. Thank you, Dr. Bangoye. It was such a wonderful section. We'll take the vote of thanks from I invite Mrs. Borojin Oshindero, the Vice Chairman, the Medical Group LCCI. Mrs. Borojin, please, you're welcome on board. Thank you so much, ma'am.
Good afternoon, everyone. I think that was a very wonderful webinar. It was truly very informative. I would just like to thank everyone for taking the time out this afternoon to share with us the information on kidney disease. I think it was just extremely informative. I'd like to thank Mr. Gabriel Ide-Husa, our very able Vice President, for giving the opening remarks. And a very special thank you to Professor Oluwatoyin Amara, hope that I got that right, for giving a very, very informative presentation on kidney diseases, the causes, and how to prevent it. I think it was a very excellent presentation because it really enlightened a lot of our knowledge on the topic. I think one of the important things I took from your presentation, Ma, was really understanding the demographics. I was very surprised to find out that in this part of the world, much younger people actually have kidney disease. So that was interesting to find out. And again, I thank you for that presentation. Professor Ebun Bamgoye, that was also a very, very great presentation on the different treatment options that are available for anyone suffering from any form of the kidney diseases. I'm sure anyone who has a loved one that has anyone with these issue will definitely have found this very, very informative. It was particularly enlightening to find that how would I say it now, that the prevalence of the disease is actually very high amongst Nigerians. And even more interesting to find out that we as a country are more reliant on prayer, I think, than everywhere else in the world. I thought that was very interesting. So webinars like this are very, very important to share more knowledge about health conditions so that Nigerians are paying a little bit more attention to not just seeking treatment, but also, prevention. So I thank everyone again. I thank all the members of the Lagos Chamber of Commerce that have been able to join us today. And God bless, and hopefully we stay safe during the COVID era. Thank you.
Thank you so much. We want to thank everyone. We thank all the participants for coming. Thank you so much for your time. Thank you for your time. Thank you so much. I had a wonderful section. Thank you, Dr. Bangoye. Thank you.
Thank you. Thank you for having us. Bye.
Bye.
Thank you, everyone.
Let's stay safe.
Thank you so much, sir. Thank you, Ma.
Thank you, Dr. Nee.